Welcome back. They are your exclusive local experts in orthopedics and sports medicine and rheumatology.
Today with OSMS, we meet an orthopedic surgeon with a passion for sports medicine and a specialty in treating rotator cuff injuries.
Dr. Peter Eggert works together with patients for a treatment plan that fits best, from non-operative solutions to surgery.
Good morning. Thanks for having us today. We're happy to be here. I'm Lauren from OSMS, and today I'm joined by Dr. Peter Eggert. He's an orthopedic surgeon at OSMS. Dr. Eggert, thanks for joining us today.
Yeah, thanks for having me.
Of course. I always like to start our segments with you introducing yourself and telling us why you became an orthopedic surgeon.
Yeah, I grew up in Wisconsin, from the area, and growing up I always enjoyed problem solving, especially using my hands to solve problems. So I found that in medical school, I could combine two passions, one helping people, but also solving those problems using my hands. So in surgery, we're able to fix a mechanical problem to provide patients relief and also get them back to that healthy lifestyle they're seeking.
That's great. I always love hearing why people started doing exactly what they're doing now. So that's really cool to hear. How about, what can patients expect from you as their orthopedic surgeon?
Yeah, my patients can expect a surgeon that works with them. We work as a team to come up with a plan that's going to fit their needs best, whether it's non-operative modalities or create a surgical plan that fits them best.
When patients come to see you, what injuries and conditions are you seeing and treating?
So I do a lot of general orthopedics. So I do joint replacement, but one of my passions is sports medicine. Especially injuries around the knee and the shoulder. So around the knee, I enjoy ACL surgery, meniscus surgery, in the shoulder, labral reconstruction, and rotator cuff repairs.
If someone were to injure their rotator cuff, what are some indications that it is injured and that they should probably see someone?
Yeah, if they start to notice pain around their shoulder, more so even on the side of their shoulder, any sort of difficulty raising their arm, any sort of weakness, those would be some signs to look out for.
Okay. Then when they come in and see you for this injury, what are some of the treatment options? I'm sure it kind of depends on the severity of the tear.
You're right. Yeah, it does depend on the severity of the tear. First, we often get an MRI to get a better sense of what does that rotator cuff tendon look like. And there are a whole host of treatment options, including physical therapy, anti-inflammatories. We can even talk about cortisone shot, and then surgery is also an option.
Is there a way to prevent rotator cuff injuries from even occurring in the first place?
Yeah, so there's some rotator cuff injuries that we just can't prevent. The more chronic rotator cuff injury pattern we can try to avoid, and using physical therapy to help strengthen our rotator cuff can be quite helpful. Also being very cognizant of how we use our arms and trying to avoid lifting heavy objects away from our body.
So is there any at-home exercises that people could be doing, or if people like going weightlifting or doing something in the gym, is there anything that they can do there to help prevent it so that they can avoid PT or something in the future?
Yeah, there's a lot of exercises you can add to your workout regimen. We actually have a whole list of exercises that we can provide patients in our clinic to start them.
Awesome. Well, if anyone would like to schedule an appointment with Dr. Eggert, he is currently seeing patients at our Neenah and Oshkosh locations. So you can give our offices a call at 920-430-8113, or you can schedule online at osmsgb.com.
OSMS has locations in Green Bay, Marinette, Neenah, and Oshkosh.
Again, to make that appointment, 430-8113, online, osmsgb.com.